Taking time now to get organized will help you during your recovery and make you feel more confident about your experience. Having people in your life who are there to support you is an important part of your recovery. They can help you through your total joint experience from pre-admission to recovery at home. They will be a second set of eyes and ears to understand your medication and remind you of your exercises. And they will be your cheerleader and keep you motivated. So to start, what do you need to know to get ready? We will review the following in the next segments of our presentation. We'll discuss how you can prepare your home for your return, how you will prepare yourself, and then finally we'll discuss discharge options. Because joint replacement is elective and you are coming in as a healthy person to have surgery, we like to encourage that mindset after surgery. For example, you will be up and dressed the morning after surgery. Most of the day is spent in a chair rather than the hospital bed. Once home, you should plan to be up and dressed daily. Making sure that your home environment is set up safely is important. In the education book you receive from the surgeon's office, there is a checklist to refer to. Plan to make modifications to your home prior to surgery to decrease the risk for falls or injury. Doing this before surgery will allow you the time you may need to make adjustments to things at home. Take the time to review these tips. After surgery, all patients will use a rolling walker. This assistive device allows you to bear weight on the leg you had surgery on without bearing full weight on it. Weight bearing as tolerated aids in the healing process. We allow total joint patients to be up and out of bed with our assistance and the use of a walker on the day of surgery. If you do not own a rolling walker or have one you can borrow, we will get you one to take home at discharge. Before surgery, plan to do a walkthrough of your home. Start in the bedroom as if you're getting out of bed. Picture using a walker and know that it will take about 2 feet of space. From your bed, walk the path to the bathroom, down the hall, go to the kitchen, the living room, and the den. Check to see that the path is clear of things that would be in your way if you were using a walker. Are there throw rugs that you could pull up temporarily? Or if you need to leave the rugs down, make sure there is a skid-resistant backing on them so you don't get hooked on anything. Look for piles of things or plants or electrical cords that may limit your ability to walk safely. Stairs and hallways should be brightly lit and free of clutter. Most homes in our area have stairs to manage, and that is often a concern for patients having total joint replacement. In general, if you are able to climb stairs now, you will be able to manage them after surgery as well. A cane will be used on the stairs. For example, if you climb stairs to go to your bedroom now, we would want you to plan to do that after surgery and sleep upstairs. Since walkers won't fit on a stair step, you will want to use a straight cane in addition to the handrail. Straight canes are not covered by insurance. So if you do not currently own one, it would be good to purchase one prior to surgery. They are inexpensive and available at most local drugstores. Taking time before surgery to assure the bathroom is set up will assure an easy transition home. We use a waterproof dressing that allows patients to shower when they are physically strong enough to do so. To prepare the bathroom to shower safely, use a rubber mat or anti-skid strips both inside and outside of the shower and tub. Remember, you will not be allowed to soak in water of any kind until your dressing and staples are removed and your incision is well healed. This includes bathtubs, hot tubs, pools, or any body of water. For toileting, the height of your toilet should be about 2 inches above the height of your knee. This allows the total hip replacement patient the ability to maintain hip precautions. We will discuss hip precautions in detail in the future segments. Often, knee replacement patients, especially if they are tall, will want to use an elevated toilet seat. For most hip and knee replacement patients, the elevated toilet seat is covered by insurance. The legs are adjustable to bring the seat up to the desired height, and the armrests allow for ease when sitting and standing. Like the rolling walker, if you do not own or are able to borrow an elevated toilet seat, we will provide this equipment for you to take home at discharge. As mentioned earlier, we encourage patients to return to their own bed to sleep when they are discharged home. You should avoid any low surface. For the most part, the rule is the higher the surface, the better. Your bed should be at least 2 inches above the height of your knee. Other things you can do to prepare your bedroom are to have a lamp and phone within reach of the bed. That way, if you get up at night or need assistance, you are set up safely. Make sure you have a clear path from the bedroom to the bathroom. Plan to turn on a light when you get up if your bedroom is dark. Again, think safety. You will feel confident and want to be out of bed and dressed and moving about your house when discharged. That includes the kitchen. We recommend you store frequently used items at waist level and less frequently used items in higher cabinets. Having a bag or basket for your walker is helpful to carry items such as a water bottle or phone. You may consider it helpful to prepare and freeze meals prior to admission to the hospital. That way, you can easily help yourself at mealtime and feel independent. Start thinking about the chair you will be sitting in after you've returned home from surgery. Ideally, it will be a comfortable chair that has a seat that is at least 2 inches above the height of your knee. It needs to have the following. Make sure it's a stable chair with armrests, a firm seat, no wheels, and some way for you to elevate your feet. A recliner is ideal because it allows you to get your feet up, and for hip replacement patients, you won't be breaking hip precautions. If you don't own a recliner, consider using an armchair and footstool or ottoman to make sure you can elevate your feet. Elevate your feet as often as possible. It is important to elevate your feet in the first few days after surgery when you are not up walking, toileting, or eating a meal. If you leave your feet on the ground, you will experience swelling in the leg you had surgery on, and this will cause additional pain. A cushion or folded blanket can be used to raise the seat of a chair. If you have limited options, then an armchair can be altered to increase the height of the seat by adding folded blankets or another cushion so you're sitting higher. As mentioned earlier, it is important to avoid low surfaces when choosing to sit anywhere. The key to a successful recovery at home is to plan to be up and about in your home daily. Perform the exercises you have been prescribed and participate in physical therapy. Elevate your legs when you are at rest, and pace your activities to allow for rest periods throughout the day.